for a 39-week pregnant female, 30 years old, second pregnancy, head is crowning. So you are 30 minutes from the nearest hospital. You arrive through the door. You're in the bathroom again on the floor, and the head is crowning, and she says, "I'm having a baby." You notice on the floor of the bathroom, dark-colored, meconium-stained amniotic fluid.
Okay, to start our timer as baby is delivered, and I'm setting a 1-minute timer. So baby is delivered. We set baby up on the mom's chest. Let's get baby in the bag,
full of
please.
meconium, like in
Baby
the
in the bag, and I'm going to grab some suction because I'm anticipating that we need that.
So baby is limp, no tone at all, no cry.
Okay, can you clamp that cord and cut that cord, please? If we're 20 seconds and we're not breathing and covering meconium, I'm going to suction the mouth here. We're at 30 seconds, so we're already got delayed cord clamping without even trying to. Suction mouth and nose. Do I get meconium out?
Yeah, there's some meconium.
Holding airway up. No, yeah, we'll get that on.
Still no breathing.
Still no breathing? Okay, we're going to move baby over here. I'm anticipating that baby's going to be problematic. Let's move. Okay, so baby positioning airway onto the towel roll. I got the targets of the ear to the sternal notch. Not breathing. Let's look at that airway really closely now. We're at 1 minute. Can you please get the heart rate monitor and SAT on, please, this child? Do I see anything else in the airway?
No, so you suctioned out, there's lots of meconium you can see, but nothing that can be suctioned.
So we're at 1 minute now. My timer just went off. Okay, we're not breathing. I'm going to put an OPA in place, and we're going to start with trying. We don't have the Untitled CO2 on yet. So we're going to try ventilating. So mask on, good EC technique. And do I get chest rise and fall?
Not the best.
Okay, I'm not getting good. Readjust my mask here. Not getting good chest rise and fall. I'm going to try two-person, please. What's with two-person bag valve mask? Do I get chest rise and fall?
So you do start getting better chest rise.
I think actually that OPA. 1 second here.
Obstructing.
Well, we'll just see here if we can get a good seal.
3, 2, 3.
Okay, am I getting chest rise and fall currently with two-person?
Much better, yes.
Okay.
You see rise and fall, equal symmetrical.
3, 2, 3.
Okay, and what's SATs and heart rate that we're currently on?
So he put them on before he was helping you. You got a heart rate of 80. Sats are 60%.
Okay, so heart rate of 80 and 60%. Can you try taking over one person here and see if you can get chest rise and fall? I think that OPA, if we take that OPA out and are we still able to get chest rise and fall with the OPA? It would just seem to affect my mass seal for some reason. Am I still getting as good chest rise and fall with the OPA?
Yes.
Yep. Do you want to try taking over that with one person and just see how that works? We're at 2 minutes now, actually at 3. I set another 1 minute timer. So heart rate currently is
Still 80.
3 minutes at 80. And so we're warm. We're in a bag. We got a hat on. We're bragging. We have heart rate less than 100, which goes with our apnea. We have pulse oximeter. What is our pulse oximeter right now?
It's rising a little bit from 60 upwards of 70.
70, and we are currently at 3 minutes. 70 at 3 is okay, so we can stay in room air. I'm going to, the next step is if heart rate goes below 100, if you don't mind watching that monitor, occasionally we dip below 100, we're going to start, we are ventilating, so I guess we'll continue ventilating because we're apneic right now, but if we go below 60, we're going to have to get into chest compression. So just keep an eye and let me know every minute. 1 more minute, Guy. What's my SATs right now?
So sats are 70, and you're noticing heart rate's 110 now.
Heart rate's 110. Okay, that's encouraging. And SATs are 70 at 4 minutes, which were a little low. So I'm going to go ahead and put a couple of liters of oxygen on. So we'll turn to 2 liters. We're connected to the bag. And I'm going to just flip over to Mr. Sopa because we've been having some challenges with ventilation, so we're going to go through corrective steps for ventilation. So we did 2-person bag valve mask, and we did find that's helpful. Are we getting a good seal with the mask right now? Do I see any option for any leak? And I'm seeing chest rise right now. Is that accurate?
Sure.
Sure. It's just not great. We'll say, but I don't see any leak around. And when we change to 2-person, do you want to try 2-person for a second? Does that make any change to chest rise and fall with the 2-person?
Oh, it definitely.
Definitely improves.
additional resources?
Yeah, do we have fire or anybody here on scene?
Yeah, they're on the way.
Okay, they're not here yet. No. Okay.
Yeah.
No, we're just gonna stay here. Breathe 2, 3. Get an adequate chest rise and fall with that. Breathe 2, 3. Breathe 2, 3. Breathe 2, 3. Breathe 2, 3. Oh. Breathe 2, 3. Breathe 2, 3. Breathe 2, 3. We're another minute. My timer just went off.
About a minute, fire arrives on scene.
Okay, can I have a firefighter? Breathe 2, 3. Who wants to come help? Breathe 2, 3. 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 Can you teach fire? Can you come over here? I'm going to use your hands for a moment. Can you come over here? I'm just you put your hands on for 2 person.
Okay,
Yep.
for mask.
Do you see how they're holding that? Yep. Go ahead. Do you see how they're holding that jaw, that mask in? Okay. We're gonna get. I'm gonna get you to do that. Okay. Can you come put your hands on? Hold, and we're just gonna put hands right on the bone of their jaw. They're not into the soft tissue, and we're pulling up. It looks like a good seal. Breathe 2, 3. Breathe 2, 3. Breathe. You hold that, and we're gonna watch. Okay, partner, can you take over this? Breathe 2, 3. Breathe 2, 3. Okay, you just hold, and what you keep eyes on here and make sure that that's still going up and down. Exact same thing. Can you watch? What's heart rate and SpO2 currently?
Heart rate's still 110, and SATs seem to be not really improving from 70%.
70%, and we are currently 70%, and we're at 6 minutes, and we're at 2 liters. I'm gonna go up to 4 liters here now. My timer's off to reassess my 1 minute timer. So we're there, and our heart rate is currently
110.
above 60. Don't need to do chest compression. So I'm going to continue with Mr. Sopa. So I'm confident with the airway. We've tried the OPA, and we did reposition. The OPA didn't seem to improve. In fact, we were having more difficulty with ventilations with the OPA. It's probably just the mannequin. We've repositioned the airway. And we are getting chest rise and fall, but it's, I'm going to listen to air entry right now and just see how is that air entry right now.
So air entry is clear and equal bilateral. You notice symmetrical chest excursion on positive pressure ventilation.
Okay, so we're getting chest rise and fall. We've suctioned the mouth and nose. We've opened the mouth. We're pulling that jaw ahead. I can see that they're pulling that jaw up into the mask. Pressure, I think we're using, we could try a little higher PEEP. We're already getting, oh, we're good. Okay, I got a leak in my bag valve mask, that's perfect. Isn't it just the way it's gonna actually happen?
Yep.
I'm gonna go to 8 liters of oxygen. How's my heart rate?
110 still.
Don't need chest compressions. Okay, so we're ventilating, we're having problems ventilating, and we're trying to fix this bag valve mask. Just until we see chest rise and fall. Okay. And our SATs aren't improving, we'll just see where that goes. Pressure increases, I think we're at a point that we're at too advanced airway. So I'm gonna look at my reference and we're gonna see what size endotracheal tube and King LT that we want for this patient. We got a 39-week patient. I want a size 3.5 tube. I'm going to be inserting that to 8.5. In my King LT, I want a size 0. Which Untitled CO2 is running there. Our extraglottic is there. I've got my tube and I got my thing here. So partner, I'm at another minute here. What's my heart rate and SATs currently?
Unchanged.
Still unchanged. We're gonna go up to. I'm gonna go up to 10 liters, or we'll go up to 15 liters. We'll just go full oxygen here. I'm sure we're well. 15 liters is more than we're gonna ever use for that kid. But so we've got light. So let me know if heart rate comes down. I'm gonna go in here. I can't stay in any longer. Maximum 15 seconds. After I get the tube in place, we're gonna immediately put the Untitled CO2 on. And then we're going to see if we have Untitled CO2 back. If we got Untitled CO2, I'll confirm air entry bilaterally. And then if we're unsuccessful, we're gonna go to that extraglottic device. And if not, back to the bag valve mask. I'm at another minute. Can you tell me what my SATs and my heart rate is at?
Not a whole lot of improvement.
Okay, so don't let me tunnel in here. Just want to be nice and quick. You got the view on that size 3 tube?
Yep.
Okay, let's just pop up here for a second. Okay, and my blade's not long enough. Can we go head back to the bag valve mask, please? getting chest rise and fall?
Yep.
Sats unchanged, heart rate unchanged.
Correct.
Firefighter, can you click that on there? Okay, let's go. Let's see that size 3. A little burp. Yep, just let me give me a finger. Perfect. I see view. 2.5. Got it. 2. Okay, tube is in. We're at 10 centimeters currently. We might be a little deep. Hold that on the top of the mouth, and we want the Untitled CO2, please. Can you attach that on there? Bag valve mask. Do I have Untitled CO2 return?
So,
Do I have Untitled CO2?
volumetric or?
I've got Untitled.
So you see,
It's just we got
positive waveform on the.
positive waveform. Do it, and we see chest rise and fall.
Yeah, chest
Um,
rise and fall.
Okay. Do you want to take your finger? Do you see I'm holding, pinching this against and holding that in place with in the roof of the mouth? So shove your finger right in the roof of the mouth and hold it against the roof of the mouth. Okay. So we have an Untitled CO2. Heart rate is still above 60.
It is.
My heart rate.
So it's increasing a little bit, 120.
I'm just going to listen bilaterally and see that we have air entry.
So air entry present.
And sats are still not up. Okay,
So
I'm
you're
gonna set
noticing
this.
they are starting to improve now.
I'm gonna set PEEP of 5 and see how we do with that. So we have an advanced airway in place, and we're currently ventilating. I'm just gonna go back through my algorithm here to a second to make sure I haven't missed anything. We are currently, and we'll just document, we're 13 minutes, and we're currently, sats are.
So they're improving. So there, you can see them trending up now. Heart
Are we
rate's trending
appropriate?
up.
So right now, after am I above 85%, or am I above 90%?
They're slowly getting up there, yeah. So basically, they eventually top off at 95%.
Okay, we're at
Heart rate
95.
increases to 160.
So we'll watch our oxygen. Okay, so we are currently warm. Let's check temperature. Firefighter, can you take we'll just stick that temperature in their armpit and hold that there.
36.7.
Okay, and so we're good with temperature. Oximetry is fine. Heart rate's, is heart rate above 100 yet?
160 now.
That's great. We have adequate ventilation. We work through Mr. Sopa. The next temperature that's good. I haven't taken a blood sugar, so
So 6.2.
and we'll throw the cuff on the patient.
Pretty much the
6.2.
end of that one. That's the goals of that.
And my what's my blood pressure?
64 over 32. That's a map of 42.
So that's over my gestational age, which is good. And we got Untitled CO2 is currently 50. To say is adequate. And we're gonna talk to mom. Hi, mom. Baby came out not breathing as well as we'd hoped. We've had to put an endotracheal tube into the baby to help the baby breathe. We're now breathing well for the baby. Our oxygen levels in their blood have improved, and we're seeing other signs that they're improving, like their heart rate's increasing up. We're gonna have to keep baby over here because we're still ventilating baby, and I'm gonna call our online physician here to see if there's anything else that they would like us to do.